My name is Amir Pakre. I'm a diagnostic radiology resident here at Beaumont Royal Oak.
My name is Alyssa Kirsch. I am a radiology resident at Beaumont Hospital Royal Oak. This program is great because it is a hybrid program. You get the volume of a private practice as well as the research, the teaching experience that you get in an academic setting.
Me and Alyssa are both R3s right now. We're in the same overall standing.
Amir is one of my co-residents, also an R3.
When Amir and Alyssa leave our training program, they're going to enter the workforce as a highly qualified, competent diagnostic radiologist.
Beaumont is a large academic hospital. They're in the top 20 largest hospitals in America. With that volume always comes a nice amount of interesting cases, a nice array of pathology.
Our program at Beaumont Royal Oak is a 5-year program. It combines both the transitional year, which is a 1-year internship before starting radiology training, and a 4-year diagnostic radiology training program.
We offer fellowships in musculoskeletal radiology, body imaging, which has several subtypes which can emphasize musculoskeletal radiology, and also breast imaging, a dedicated breast imaging fellowship, and a dedicated neuroradiology fellowship.
The radiology residency program has been here for many, many years. Dr. Jalil Farah really had a vision for making the radiology residency a nationally known program.
Learning here at Beaumont, I think, is very special for a few reasons. First off, having 2 conferences a day on average is very helpful.
We have both resident-led conferences and attending-led conferences. These can include case-based conferences as well as didactic conferences that are led by experts in their field.
When you're in training, you want to see everything and high volumes of it. It doesn't mean you have to read all of that volume. We have plenty of people to get the volume done, but you want to be exposed to that on a daily basis.
You don't have to worry about going elsewhere for your intern year. You can stay right here for a transitional year and get 2 months of radiology in your first intern year.
I've done a reasonable amount of research since I've been here, and a lot of our staff are very research oriented. We have a nice array of reading and contrast coverage for moonlighting. Obviously it comes with the benefit of pay, but it's helped me excel academically.
At Beaumont, we have over 90 radiologists that are all subspecialty trained, and they practice in their field.
Fellows and residents are allowed to work within their own means. Staff are always nearby and available, often reading side by side with them.
A lot of these staff are here because they want to teach. They want to be here. That helps so much. Obviously, you do a lot of your learning on your own at home when you read, but there are so many nuances in radiology that comes from being in the reading room, going through a case, having the actual staff and attending point out, talk about certain things that then tie back and further reinforce what you had read.
I think it also speaks to the hospital itself and the program itself because it's just such a friendly and warm environment.
The camaraderie that I have with my colleagues makes it enjoyable to come to work every day.
Our program is just filled with such great people who want to help each other.
The endowment fund was started by Dr. Jalil Farah, who's my father. We had set some guidelines as to what we wanted to use the fund for. So for many years, we have invited national known speakers and then had speakers from our own department giving lectures. Another arm was the development of a Resident of the Year award. We felt it was important to recognize residents that really embodied the principles that we felt were valuable to our program.
Beaumont Royal Oak also offers an ESIR pathway for candidates that are interested in interventional radiology but don't match into an interventional radiology residency right out of medical school.
The integrated interventional program here at Beaumont Hospital offers a highly competitive experience with full gamut of interventional procedures and caseloads.
And most of our day is spent doing procedures. It's a lot of hands-on. I'm the primary operator on most of the cases. The attendings are very good about letting me have the hands-on, helping me work through the difficulties that a procedure will bring to you.
The diversity of cases varies from day to day. It can be venous access, it can be interventional oncology with chemoembolization, radioembolization, cryoablation, radiofrequency ablation.
One of the things I really enjoy is being able to experience all of those different aspects kind of all on the same day.
All the interventional radiologists have trained at other institutions, which allows other techniques and other concepts to be brought to Beaumont.
What I love about the overall residency itself is your ability to integrate with your class and the entire program itself.
This hospital has a very nice blend of bridging the best of the academic side of the spectrum and the best of the private practice side of the spectrum into a very nice hybrid program.
Coming here, you will get both training in becoming a very practical clinical radiologist, able to go into private practice or even into an academic setting. So we really fulfill both aspects of future career choices in radiology.
We come from an environment that's very cordial and helping people out, and I think that'll carry people out into the practice.
I like what I do, and I love where I'm at.